Assalamu alaikum. So, in this video, we are going to discuss a very important topic of the endocrine system, which is multiple endocrine neoplasias. Multiple endocrine neoplasias are commonly known as MEN syndrome, and they are inherited diseases, and basically, they are the tumors of the endocrine glands. It's very important for you to know the mode of inheritance of this syndrome, and the mnemonic for this is the X-men are dominant over villains. So men are always dominant. So you need to remember that all men syndromes are autosomal dominant disorders. So they can be divided into type 1 and type 2. Type 2 are further divided into type 2A and type 2B. Type A, basically the mnemonic to remember the tumors which are involved in this syndrome is for type 1 there are 3 P's which include pituitary adenomas, parathyroid adenomas, pancreatic endocrine tumors. Whereas for type 2A there are 2 P's and there is 1 M. 2 P's include few chromocytomas, parathyroid hyperplasias, and then there is a medullary thyroid carcinomas. Whereas type 2B consists of 1P and 2 M's. 1P is basically few chromocytomas and the other M is medullary thyroid carcinoma, and the new M is basically the mucosal neuroma. Moreover, men type 2B is also associated with marfanoid habitus. Before we get into the further details of these tumors which are associated in the MEN syndrome, we need to know the mutations that are involved in type 1 and type 2. Type 1 is basically associated with the mutation on chromosome number 11 that codes for menin and the tumor suppressor gene, whereas type 2 is associated with the mutation in the proto-oncogene that codes for receptor for tyrosine kinase, and it's present on chromosome number 10. Now we are going to discuss the tumors. So first of all, there are pituitary adenomas. Pituitary adenomas, they can present with pressure symptoms, for example headache, vision problems. Prolactinomas are very common. Then they can present with galactorrhea in females and gynecomastia in males. Whereas pancreatic endocrine tumors, there are a number of pancreatic endocrine tumors such as insulinomas and glucogenomas. So pancreatic endocrine tumors can present with hyper and hypoglycemia. Parathyroid adenomas are also very common. Increase in parathyroid hormone can basically result in increased bone resorption, and that can cause hypercalcemia, and that can result in the deposition of the calcium kidney stones. Men type 2A can present with few chromocytomas, which include the symptoms of increased catecholamines that include increase in anxiety and increase in sweating, increased blood pressure, whereas medullary thyroid carcinomas are the neoplasm of the parafollicular C cells and that secrete calcitonin. And then we come to men type 2B, which includes the mucosal neuromas. Mucosal neuromas are basically that derive from the nerve tissue, and they're more commonly seen on the oral and the intestinal ganglioneuromatosis, for example on tongue, on lips, on roof of the mouth. And the diagnosis of these syndromes are basically um, done by genetic testing for the mutation. So the management for MEN syndrome is basically surgery of these tumors and thyroidectomy to prevent the medullary carcinoma. So this was all. It was a very short topic but very important topic for the MCQs. I hope you understand it. So thank you for listening.